is fine. Today we are going to talk about the reflexes in infants. Yes, you heard it right. We'll see are related to the reflexes which are developed by the time the child is born. A reflex is an involuntary, or you can say the automatic action that your body does in response to something that even your body doesn't have to think about. What is a neonatal reflexes? The inborn reflexes at birth and which occur in a predictable manner can be seen that at the time of the birth of the child. Normally, these developing newborn, they should respond to certain stimuli with these reflexes for checking their normalcy, for checking any kind of abnormalities. What is the significance of reflexes, and for what reason we have to find out the reflexes in these children? By checking the reflexes, they help a pediatrician to identify whether the child is developing normally or the child is having any kind of problems. It will also tell about the abnormalities that the child may be having if these reflexes are not completed, or if all the reflexes are not present in the baby. It help us improve the knowledge of development of the motor skills of the child. It will help us to identify whether the development is going at a proper pace, or whether the child is lacking at any kind of stage of the development. There are various number of reflexes which we'll talk about. The general body reflexes can be Moro, or you can call it as the startle reflex, Palmer or the grass reflex, plantar grass reflex, walking or the stepping reflex, limb placement reflex, asymmetric tonic neck reflex, symmetric tonic neck reflex, Babinski's reflex, the Babkin reflex, parachute reflex, Lonto reflex, withdrawal reflex, the trunk incurvation reflex, tendon reflex, Gallant's reflex, tonic labyrinthine reflex. Let's see some of the facial reflexes which we can find out. The nasal reflex, blink reflex, doll's eye reflex, auditory orienting reflex. Some of the reflexes present, by the oral area, or we can say the oral reflexes: rooting reflex, sucking reflex, swallowing reflex, gag reflex, presence of cry reflex. First, we'll talk about regarding the general body reflexes. What all are included in this? We'll talk about most common reflexes. Let's start with the Moro reflex, or I can say it's also called as the startle reflex. The Moro reflex, it's an infantile reflex that develops between the 28th and 32 weeks of the gestation. A Moro reflex may involve the infants, suddenly splashing their arms and moving the legs before the arms come in contact back to the position, and it is a response to stress usually. This reflex will help the babies to develop controlled skill of the walking. What can be the clinical significance of this reflex? Its nature will give us the indication of the muscle tone first, and if there is failure of the arms to move freely or the hands to open fully, it will indicate there is the decrease in the muscle tone that we call as hypotonia. This the reflex will disappear by the 3 to 6 months of the age. The second reflex we are going to talk about is the Palmer or the grasp reflex. This reflex can be elicited usually in all infants during the first 3 to 6 months of the age. Light touch of the palm of the baby, it will produce the reflex flexion of the fingers. The most effective to check this reflex is usually by sliding the stimulating object while you are sliding the stimulating object over the child's or the baby's palm, such as finger or pencil across the end of the palm from the lateral border. The child will suddenly splash the fingers of the hand. This reflex will disappear by the age of 3 to 4 months. The clinical significance of this reflex, in presence of the cerebral palsy or in presence of the hemiplegia in the baby, that is the half or the portion of the baby's body is paralyzed. In these conditions, this reflex may be asymmetrical and you won't be able to feel the normal splashing of the fingers. Usually, this will disappear by the age of 3 to 4 months. But if this reflex persisted more than or beyond that time, then it may indicate there is the spastic form of paralysis present in the babies. Next reflex we'll talk about is the plantar grasp reflex. While placing any object or fingers beneath the toes of the baby, it will cause a curling of toes around the object. This will be present by the time of the birth and it will disappear at the 9 to 12 months of the age. Next reflex is the walking or the stepping reflex. A baby appears usually to take steps, or it looks like the dancing part when the child is held upright with his or her feet touching any solid ground or solid surface. This is present at birth and this will disappear approximately 2 to 4 months of the age. With daily practice of this reflex, the baby or the infant may walk alone at the age of 10 months. Clinical significance for this reflex: in case of the premature infants, when the baby or the child is not born, after an adequate period of the time, that's the gestation period. So, in case of the premature infants, they will tend to walk in a toe heel fashion. Usually, the mature or the normal infants, they walk in a heel and toe pattern. Limb placement reflex is another general body reflex. When the front of the leg, that is below the knee, or the arm below the elbow is brought into contact with an edge of a table or edge of a surface, the child will lift the limb over the edge. They try to lift the limb or the arm above that surface. This is present at the birth and it will usually fade immediately or rapidly in early months of the life. Clinical significance. This reflex is usually or the readily demonstrable in the newborn, and if the persistent failure of this reflex persisted, or if the child is not able to respond to this reflex, then this is thought to have some of the neurological abnormalities over this stage. Next reflex we are going to talk about is the withdrawal reflex. This is a spinal reflex which is intended to protect the body from any kind of damaging stimuli. So, stimulus is a pinprick or a sharp, painful stimulus is given to the sole of the foot. The response will be the flexion and the withdrawal of stimulated leg. It is present at birth and it will persist throughout the life. Clinical significance for this reflex. This reflex, if not responded properly, if there is an absence of this reflex, it will indicate there is the neurological abnormalities, there is impairment in the neurological part of the infants. Next, we are going to talk about is the Babinski's reflexes. Babinski's reflex is most common and the normal reflex in the infants. This reflex occurs after the sole of the baby's foot is firmly being stroked, and the baby's reflex will be the big toe from the baby's foot. It will move upward and forward the top surface of the foot. This is present at birth and this will disappear at approximately 9 to 10 months of the age. Next reflex is the Babkin reflex. In this reflex, the deep pressure applied simultaneously to the palms of both the hands of the baby while the infant is in supine position. The stimulus is followed by the flexion or forward bowing of the head, opening the mouth and closing the eyes. This reflex usually emerges around 9 weeks of the age, that is in the utero itself, and it is present during the first 3 months after the birth, and it should be integrated or faded around 4 months of the age. Next comes the tender reflex. These are simple monosynaptic reflexes which are elicited by sudden stretch of a muscle tendon. This occurs when the tendon of the baby is trapped. This is present at the time of the birth and it will be continued throughout the life. Now we'll talk about some of the facial reflexes which are seen in infants. In that, the first one comes the blink reflex, or you can call it as the corneal reflex. You will see this reflex by a bright light suddenly into the eyes of a baby, a puff of air which is upon the sensitive area of the eye, that is the cornea, or a sudden loud noise will produce immediate blinking of the baby's eyes. The purpose of this reflex is to protect the eyes from any foreign bodies and if there is presence of the bright light, so that the child can protect the eyes by blinking reflex. These reflexes these are easily seen in the neonates and it is to be continued throughout the life. The clinical significance. This is used, as a part of some neurological examinations and particularly when checking a person's, the senses in coma. The satisfactory demonstration of these reflexes indicate when these reflexes are proper and, they are normal. It will indicate there is no presence of the cerebral depression. There is the possibility of the contraction of the appropriate muscles in response to these reflexes. Next, we'll talk about the doll's eye reflex, or you can call it as oculocephalic reflex. When the head of the baby is turned away, that means the passive turning of the head of the newborn, it will leave the eyes behind. It will leave the eyes stationary. Immediately, they cannot adjust to the new position, so they cannot move the eyes along with the turning of the head. This will be present at the time of birth and it will disappear within a week or 2 weeks of the birth. If this reflex is not present or if it is not proper, then it may indicate the cerebral lesions present in the baby's head. Next reflex comes auditory orienting reflexes. A sudden loud noise or unpleasant noise may produce the blink reflex of a baby, or it may remain still and show increased alertness. In case of the quieter sounds, it may usually cause reflex of the eye and head turning to the side of the sound as if to get focus, as if to locate the sound when it is heard. It's seen usually at the age of 4 months of the age. Clinical significance of this reflex. These reflexes are made to test the infants for the hearing loss, and it also shows the level of maturity, neurological maturity in the infants. Then we'll talk about the oral reflexes seen in the infants. The first among the oral reflexes are the rooting reflex. Yes, you may know this reflex as it's very commonly seen and most appropriately we are much recognizing this reflex. The rooting reflex happens when the corner of the baby's mouth touches the nipple or the skin, then it will allow the baby for breastfeeding. We can also trigger this reflex by stroking or gently touching the corner of the baby's mouth, or striking very firmly over the middle of the lip. Then the child will turn the head and follow the root in that direction. This will disappear by the age of 3 to 4 months. The next reflex comes the extrusion reflex. When the baby's tongue is touched or it is depressed, then the infant responds by forcing it outwards, that means protruding the tongue outwards. The extrusion reflex helps the baby to latch into a nipple as well as it will help the child to prevent from the choking. This reflex will disappear by 4 months of the age. The sucking or the swallowing reflex. Touching lips or placing something in baby's mouth will cause baby to draw liquid into mouth by creating vacuum with lips, cheek and the tongue. So the sucking or the swallowing reflex will disappear by the age of 12 months. Next, we'll talk about the gag reflex, or you can call it as the pharyngeal reflex. Gagging it is a reflex action that helps to prevent the choking. It can be triggered by fingers or by spoon or by food or toys when touching the back of the mouth or the palate of the mouth. The gag reflex will diminish around 6 months of the age. The clinical significance of the gag reflex is: if the gag reflex is not present, the absence of it may indicate a various number of symptoms, which may indicate some severe medical conditions, like for example, the damage to the glossopharyngeal nerve or the vagus nerve. It may also indicate the brain death. The cry reflexes. Infants have a cry reflex that is normal response to a stimuli such as the pain and the hunger may lead to the cry. The premature babies, they are lacking in cry. That means they do not have a cry reflex. Therefore, they must be mentioned or they must be monitored closely for signs of the hunger and the pain, as you may not be able to find out when the child is in a pain or hunger because they don't have a cry reflex and you are not able to evaluate that. Let me conclude the reflexes, the most common reflexes which we have talked about today. So, the appropriate knowledge of the reflexes or knowing the normalcy and the abnormality of the reflexes, it will allow a pediatrician to identify whether the child is developing normal or not. It will give the knowledge of the abnormalities as well if all the reflexes are not proper, if all the reflexes are not responding to the stimulus. And we have seen some of the common reflexes as the general body reflexes we have seen facial reflexes, oral reflexes we have seen, or we have seen some of the nasal reflexes. So we have seen all the reflexes which are very necessary to find out during the period of the birth or during the period of the presence or the persistence of the reflexes. And we have seen the reflexes and their significance, whether the child is responding normal to the stimuli or the child is lacking the reflex too. I'll see you in the next session. Till then, take care and thank you.